In Montgomery County, a hospital is unveiling a new safe center.
And that center is for victims of crimes like domestic violence, also child abuse. Jennifer, it's a way to give victims the resources they need, all in a protected space. This is a great idea here.
Yes, it definitely is, Sheba and Jason. Before victims of abuse, they were seen at the emergency department here at Jefferson Abington Hospital, and the community decided that they wanted a better way to treat and protect these victims.
So you don't have the loud noises, you don't have the hustle and bustle, you can bypass the waiting area.
This is the new Safe Center at Jefferson Abington Hospital. Forensic coordinator Jayla Atkins says people who experience sexual assault, child abuse, elder abuse, cognitive delay abuse, human trafficking, and domestic violence will receive care by specialized trained nurses in this thoughtfully renovated space.
Abuse of any type of assault.
Atkins says the community raised $700,000 for this project. There's even locked cabinets to store evidence for police and a private shower in the exam room.
So now we have a place where we can do that, and then people have donated, new clothes that I can give to the patients so they can go home and in clothing instead of paper scrubs.
In 2020, there were just over 200 visits for forensic nurse examiner consults, and last year, 245 visits.
Those exams are patient-guided, and they can take hours long. Something that's very difficult and challenging in a busy, chaotic, emergency department.
The East Norriton Township Police Chief says the space provides a victim-centered approach, bringing together healthcare, law enforcement, and community partners so the victim isn't victimized by the system.
A victim wears three hats. So the victim is not just a victim, they're a patient. They have to be medically treated. They're also a potential witness. And most importantly, they wear the hat of being a human being.
And that's what I want my patients to know, is that when they come here, that they can start on their way to heal and to feel safe again.
And as you saw, there was a great turnout for this ribbon cutting. A lot of people who care about the victims in these situations. Stakeholders included police, victim advocates, as well as doctors and nurses. And Jason and Sheba, I was told that the first patient has already been treated at the Safe Center just last week.
All right, fast work already. Jennifer, thank you.
Thank you.